Autopsy. It means self. Auto means self and ops mean viewing. So it means self viewing. Two other synonymous words which are also used, necropsy and postmortem examination. Necros mean dead, and so it means the examination of dead. Recently, the autopsy is used for the human beings and necropsy is used for the animals or other inanimate things. Postmortem examination is the examination after death, and in USA and some other countries, autopsy and postmortem examinations, they are two different procedures. Postmortem examination in USA, postmortem examination means only external examination of the body without cutting it. However, collection of specimens like fluids, urine, blood with the help of needle, they are included in this examination. Whereas the autopsy means complete examination of dead body, both external surface and the internal contents after opening its cavities. And also the materials can be collected for histopathological, biochemical or toxicological examinations. So what are various types of autopsies? They are physical autopsy, which may be either medical or medico-legal, then psychological autopsy, virtual autopsy, and mini autopsy. So, physical autopsy is also divided into medical and medico-legal autopsy, whereas psychological autopsy is basically a sort of investigation. And virtual autopsy I'll be discussing, and mini autopsy. Now, the medical or the hospital autopsy. The medical autopsy is the one which is conducted for the medical reasons, to confirm or to establish the diagnosis, where the clinical diagnosis during the life of the patient remains unascertained. These medical autopsies are conducted on natural deaths occurring in the hospitals. They are conducted autopsies by the physicians or the pathologists to establish the medical cause of death, especially where the clinical investigation during the life of the patient remains futile in establishing it. Now, the medico-legal autopsy. It is autopsy of all unnatural deaths, and it is the complete scientific study of the dead body externally as well as internally to establish cause, mode, and manner of death under the law of state, for the protection of society and administration of justice. So this is the definition of medico-legal autopsy. So it's a complete scientific examination. Now about the psychological autopsy, it is an investigation. Basically, it's an investigation along with the physical autopsy of the dead body. Psychological autopsy is performed in alleged cases of suicide to know about the mental status of the deceased at the time of death. Information about the background of the person, it is also gathered from the parents, from the society, from the neighbors, from the office colleagues. Now about the mini autopsy. This is the term which is used for a type of partial autopsy in which there is extensive organ sampling can be done, or organs removal can be done through a limited incision on the abdomen. For example, about 50 centimeter incision in the upper abdomen can be made for the collection of the viscera. Now, virtual autopsy, which is also known as autopsy. So what is virtual autopsy? It is an emerging science where the doctors attempt to assess the cause of death using digital radiodiagnostics. It is an post-mortem examination without compromising the integrity of the body, even without collection of the sample. By using the digital CT scan and MRI instead of cutting the body, the countries like Switzerland, USA, Australia, and Malaysia, and where Japan, and where there are also other countries, they are already using this technique. If due to some reason or disease the autopsy of the body is not possible, then the help of radiological examination we can detect the cause of death. X-ray, ultrasound, MRI, CT scan, they are done. Now, how it is done? What is the procedure? First, the body is put in a sealed bag and then it is put through the CT scan machine. It finishes in seconds and acquires about 50,000 images of bodies inside. So, how fast and how quick it is. Internal bleeding, bullet tracks, and hidden fractures, they can also be detected by this technique, which are hard to find out in the routine autopsy procedures. It can complement the standard autopsy techniques and will increase the quality of assessment of the knowing about the cause of death. It permits additional analysis by other forensic pathologists on the same day. That means you can send the data by mail or by uh, other multimedia techniques. You can send to the other person, other expert, and you can get the opinion from the other person at the same time on the same body. And it can even be studied even after years when some allegation crops up in future. Then the virtual autopsy methods which are used, they are postmortem CT scan, which is computed or computerized tomography, and MRI, which is mass resonance imaging. They are increasing nowadays. In posthumous screening, this is the machine which is used in virtual autopsy. There are a number of other machines which are attached to it, they are also used. High resolution surface scanner. It is for the detailed documentation of the surface of the body. Then computer assisted biopsy can be done. For this, the automatic collection of tissues and blood sample can be done with the help of this machine. Then magnetic resonance or computed tomography, it is for the three-dimensional imaging. Then the heart-lung machine is being used. It is used for the posthumous use of contrast solution in the circulatory system to know about the patency of the or where there is leak or damage of the circulatory system. So this is the machine which is you can see is the posthumous screening machine which is used in the virtual autopsy. There is attached high resolution surface scanner and a computer supported biopsy is also attached. Then magnetic resonance and computed tomography which gives you the three-dimensional image, and the heart-lung machine which is used for the using of contrast to check the circulatory system. So this is complete machines which are helpful in virtual autopsy. Now what are the benefits of virtual autopsy? Body remains intact, number one. Then it takes less time. You can see that in few seconds you can get 25,000 slices of the inside of the body. And it can be reviewed later as and when it is required. And it can take the help of other remote forensic pathologists by sending the data and receiving his opinion. For forensic autopsy surgeons who are not basically trained in radiological techniques, it is difficult for them to understand the axial anatomic orientation of the axial postmortem CT images. That means they are unable to read the CT images. But now there is a computer software which permits the postmortem CT datasets to be quickly and intelligently resliced in a real time at the body. And it narrows the gap between the radiological imaging and autopsy. That means it translates the CT datasets into real images of autopsy. Now, the autopsy can be positive or negative autopsy. The negative autopsy means where the cause of death cannot be certain besides all the efforts. All the efforts mean the dissection of the body and analytical or histopathological or biochemical or all the investigation which is done fail to reveal the cause of death, then the autopsy is said to be negative autopsy. And the positive autopsy, when there is definitive conclusion about the cause of death can be drawn. Now, there is a decline of autopsy in our country and also world over. In our country, basically the hospital or the medical autopsy, they are usually not done. And there is also a global decline in the practice of medical autopsy for various reasons. And what are the causes of decline? Religious restrictions, emotionally the persons do not allow, then the conceptual beliefs of the people. So all these social taboos and myths and their beliefs, they refrain them to get the autopsy of their deceased. Then these hospitals are overburdened and the doctor's main concern is the treatment of living. Number third, the teaching staff and the doctors, they are already overcommitted and there are more advancements in the diagnostic aids like CT scan, MRI, they are available. So they are more appropriately diagnosing the diseases. So the suggestions for the improvement are that all the big hospitals should have the arrangements of the autopsy examination. But sometimes it is found that the clinical diagnosis is wrong in establishing the cause of death in about 50% of cases besides all these fancy gadgets developments. So in our country the hospital autopsy is not usually done, so there is a generally decline in the practice of medical autopsy. And whenever the medical autopsy there is a conflict or there is a negligence or there is an allegation of some wrongdoing by the doctor or any paramedics, then this medical autopsy will naturally become the medico-legal autopsy. Now, what is autopsy rate? Autopsy rate is the number of autopsies conducted on all deaths occurring in a community. So it is the total number of autopsies, including medical, medico-legal or other mini autopsies or psychological autopsies, all types of autopsies on all deaths. Whereas the autopsy index is the total number of medico-legal autopsies. This is total number of medico-legal autopsies conducted on all deaths occurring in a community.